You are probably here because you want to quit smoking, and well done for taking the first step towards the best thing that you can do for your health and other people's health. So I am going to help you quit in this video. In this video, I'm going to teach you how to quit smoking, self-help tips, as well as the benefits of stopping. So what we're waiting for, there's lots to get through, so let's begin. Now, when it comes to quitting, there's two options really. The first one is going cold turkey, which is quite difficult. The second one is using nicotine replacement therapy. We call it NRT for short, and this can double your chances of quitting. Basically, the NRT is going to help with the cravings, to reduce that. We're going to talk about different products now, and also stay tuned because I'm also going to talk about vaping and e-cigarettes as well. So let's work through the different NRTs. The first one I'm going to talk about are patches. This basically gives us our baseline nicotine, okay? So you need to use patches, and everything else that I discuss is add-ons basically to reduce cravings. With patches, you basically stick them onto a hairless part of the skin, and you leave them on for either 16 hours or 24 hours, and this is all going to help reduce your cravings. The next NRT we're going to talk about is gum, okay? These are great to keep in your pocket or your bag or wherever, and whenever you're having a craving, you can basically chew on it. It's also fun, it distracts you from wanting to smoke, but you're also getting that nicotine kick, which is going to help lower our craving. Next up, we have lozenges. These are basically like boiled sweets. You suck on them, they're perfect on the go, and they help curb cravings. Also, another option we have are Microtabs. Microtabs, you basically put them under your tongue. They dissolve quickly, very convenient to carry around as well, especially if you don't like gum, for example. And again, they can help curb that craving again. Moving on to the fifth NRT, we have inhalators. These are small little tubes. You basically place it in your mouth and you take a breath in, and it gives you a dose of nicotine. It's really good for that hand to mouth sort of action, and as well as sort of curbing those cravings, okay? That's basically the purpose of all the NRTs here. The last two remaining NRTs, we have a mouth spray and we have a nasal spray. These two are probably the fastest at getting you that nicotine hit, basically, when you're really feeling the cravings coming on. In terms of which one gives you the fastest response, it would definitely be the nasal spray, then followed by the mouth spray. Now, in recent years, vaping or e-cigarettes have become quite popular here in the UK as a means to quit smoking. Compared to traditional cigarettes, they are actually far less harmful and can be a really useful aid for us to quit. Now, vapes and e-cigarettes, they basically work the same way. They have an element that heats up this liquid, and this liquid contains a few ingredients. It's got nicotine, it's got propylene glycol, it's got vegetable glycerin, and sometimes it has flavoring as well. So you're able to basically vaporize the nicotine, breathe it in, and that's going to help with the craving. But instead, compared to tobacco smoking, you don't get the tar or carbon monoxide, which are two of the most harmful parts of smoking. And many people are actually managing to quit smoking through using vapes and e-cigarettes, okay? In fact, a 2021 review showed that those who used vapes or e-cigarettes with expert help were twice as likely to quit smoking. So they can be a really helpful tool. Now, in addition to the NRTs, as well as vaping that we just spoke about, you might consider prescription medication by speaking to your medical provider. Some options, for example, Vareniciline, you might have heard of that one. It basically targets nicotine receptors and lowers our cravings. Another one is called Cytisine. This is actually a natural plant-based compound. They're both very effective at helping. So again, if this is something that you'd like to look into more, speak to your medical provider about it. Now let's move straight on to 5 self-help tips, okay? First of all, you're gonna get your phone out or get a pen and paper, write down all the reasons that you are quitting and carry that with you at all times. Hence why I'm saying it's easier if you've got your phone, because you can basically access it at any time and give it a read. So it just continues to refresh the reason you're wanting to quit. 2, get active. Go for a walk, go for a run. These are gonna release endorphins, they're feel-good hormones. It's also gonna help cut down those cravings. 3, you need to declutter, okay? Anything that reminds you of smoking, an ashtray, a lighter, matches, anything like that, get rid of them, okay? We don't want to see any of that because it's not going to help at all. 4, identify triggers. You need to write down what the triggers are, okay? And avoid them. So list them out and make sure you are avoiding them. 5, build a support network. Tell your friends, tell your family. There's also groups that you can join. This support network is just going to help you, especially if sometimes you're getting a craving and you really want to smoke. That support network can really stop you from going back to smoking that cigarette. Now, if you want more information or treatment options for a particular medical condition, then let me tell you about Dr. Fox, who are very good friends of the channel. Dr. Fox is an online doctor and pharmacy ready to help with over 30 different medical conditions. And to learn more about their fantastic services, I will leave a link in the description below. Definitely do check them out. Dr. Fox, thank you for being our trusted sponsor. Now, if you've made it so far, you are serious about quitting. So well done on getting this far. The benefits of quitting smoking, they are massive. There's so many. Just 20 minutes after your last cigarette, we're going to see your heart rate start to come down. And we're also going to start flushing out that carbon monoxide that's bound to our red blood cells, basically. That happens within the next 48 hours. You're then going to start breathing easier. You'll be able to walk more, exercise more without getting out of breath. Your teeth are going to get whiter. Your skin's going to look better. You won't age as fast. Your heart is going to be thankful. There are so many benefits, okay? Not only that, but also immune system is one that no one talks about, and your immune system is going to boost and increase as well. So if you ever hurt something, if you're ever not feeling well, you will recover faster as well. These are just some of the benefits. There are so many that I could go through. And here's just a pro tip for all you caffeine lovers out there. Nicotine actually reduces the effectiveness of caffeine, okay? So once you quit, you need to consider reducing your caffeine intake a bit, because what you could previously tolerate is probably going to be way too much for you now. So it's just a pro tip. Now, do remember, you've got this. I completely believe in you, but please do not be discouraged if you don't manage to quit the first time. Many people need to have multiple attempts to quit, okay? But don't get discouraged, okay? Keep trying to quit, and eventually you can do this. As always, sending awesome vibes.